this because it's a very powerful tool for evidence collecting, and also it's a very powerful tool for collecting data, visionary data. Yeah, that's it. Thank you very much.
Thank you very much, Alima. My name is Nsubuga Aksam, an associate under the Advocacy Capacity Enhancement here at Ahaki. I would choose that extension because you realize it's one that connects to all power sources. Ideally, if there was a solar panel, that's what I would have chosen. Yeah, that's it. Thank you.
Thank you, everyone. So basically, I hope that at the end of today, we should be able to promote deeper interest in digital health data management and innovation systems. As you have seen on the program, our theme is digital health innovation and technology for youth empowerment. So we intend to contribute to the understanding and contesting the digital inequalities related to digital health data management in Uganda. And we hope that we can be able to come up with an ideal mechanism for digital health data management, benchmarking on the experiences of the youth. From just the introductions, I could see some youth displaying energy. So we hope that we can tap on your energy and be able to come up with some good mechanism for ideal data management. And the last one, we also anticipate that we shall be sharing experiences on the strength and the challenges that are faced by the youth in using digital technology. So without wasting our time, I'm going to call on our Director of Programs, Mr. Baguma Christopher, to open up this session, and then we can be ready to start. Christopher, you're welcome.
Good morning once again. As already introduced myself, Baguma Christophe is my name. I work as the Director of Programs at Afya Nahaki. First, I would like to welcome you to Afya Nahaki, our village. I know you've attested it, some of you, if it's your first time to this village of Nakwero. So we don't take your coming here for granted. We appreciate the time you've put in to come and be with us and share your experiences, and also to learn from you on the topical issue that we shall be discussing today, and more especially surrounding around the youth, then the technology, looking at the health, how they interlink or intersect with one another. As Ahaki, one of our themes is around, as Alima had said, health technologies and human rights. So part of our work, even when we are generating evidence, when we are doing capacity enhancement, we make sure that one of the themes is around health technologies. As you know, health technologies have developed or have evolved right away from the 60s, 70s, 80s, 90s, and the 2000s, where we are now. And these have evolved through different sectors. But of late, we've seen the evolvement of technologies into the health sector and the health service delivery. Of course, being a new trend, you find that many players come into play. The developers will come into play, the users will come into play, the owners of these apps or technologies will come into into play. And you will find that we are all concerned and we are all affected in one way or the other when we focus on health service delivery. With this, we've seen the development or the emerging of health apps in terms of access to services. We have the Mobi Clinic. Someone is coming from Mobi Clinic. We have Rocket Health, which you know, and it offers health services, mobile health services. You are here in Nakwero, you just go on their app, you put in your details, particulars, within 10 to 20 minutes, they are at the site and they are giving you the health services. The 7 Doctors app, all these applications that are geared towards solving the health problems. But do we all use these apps? But one of the interesting things is that all these apps are linked either to web-based platforms, there are apps in nature, and also social networking sites. And you find that all these platforms, the most people who interact with these platforms are the youth. And youth like using internet and all those web-based applications on internet. So it means the youth access these services or these apps more than any other person in this world or even in Uganda. And you find that at around 2.8 million people in Uganda are accessing the social websites or social networking sites. So that means we are among the people who are accessing these sites, be it for our entertainment, be it for health and all other reasons. Those social networking sites ranging from Facebook, Instagram, TikTok, and all that. And when we are using this, we need to be cognizant that whatever we put out there is involved with data. What we are putting out there is basically what? Data. At that process of initiating your account, what you give out is information. It's your data. You've given it out. We don't care. Some of us, even if they say, read these instructions, when you click OK, but we don't read. You just go, where is submit or where is OK?